Wally from the University of Leeds, and I would like to tell you about non-communicable diseases, training modules and guidelines that we've worked on in Nigeria and other countries. So I think you know that non-communicable diseases like diabetes and hypertension and others like depression and other diseases are increasing rapidly in low and middle income countries across Africa and Asia and elsewhere. So up till now, countries have not had guidelines on how to treat these conditions for the doctors, the nurses in primary healthcare facilities. So we've been working together in what's called the COMDIS research program funded by UK Aid, that is the Nuffield Centre, University of Leeds, and our partners in other countries to develop guidelines on diabetes, hypertension and these other non-communicable diseases. So these were developed and piloted in various countries, and we have done trials, we've done other studies to show that they actually do work and produce improvements in care, including controlling blood pressure, controlling glucose in diabetics, etc. So the evidence is strong for this to work. Then we produced a generic package which is available to other countries, and Nigeria was one of the countries that recognized the scale of the problem and were keen to develop guidelines for this purpose. Now we started with the World Health Organization, WHO, 10 guidelines for NCDs, and those guidelines were incorporated into the desk guide, job aids and training modules that we developed. Nigeria Federal Ministry were very happy with this adaptation of the WHO guidelines. They were very happy because they were made to be feasible and usable in a real life, everyday setting in their health centres and general hospital outpatients. So they got together a technical working group, and the ministry went through very thoroughly to adapt those guidelines to the context of primary healthcare centres and general hospital outpatients in Nigeria. Those adaptations to the guides and the training modules were then piloted down in the southeast of the country, and with that experience we realized we had to revise them even further to make them even more user-friendly, possible to use in everyday clinical practice, and to revise and refine. So that was done, and then we've started with the support of the RUHF project of QMU Edinburgh. That funding has enabled us to do a further piloting and development with training and piloting in the southeast in Cross River State, and that team from FIND, which is an NGO which is working with the ministry to develop these materials, are currently training and piloting these guidelines. The Ministry of Health, federal in Nigeria, has already adopted these materials. With the refinements made, will then have already committed to roll out these across Nigeria. Of course, there are many difficult issues to resolve, such as working with the insurance scheme, working with any other funds available to ensure that drugs are available and that treatment cards are printed, staff are trained, etc. To enable the staff training to happen, with FIND and Instruct, we've developed an mHealth version of this training, which means that people can log in, pay a small amount of money, do the training with a pre-test, post-test, and get CPD, that's continuing professional development points, towards their requirement, and then they will have the competence to manage these conditions such as hypertension, diabetes, COPD, etc. So that mHealth version will be available to enable scale-up in Nigeria, in the public sector, and also doctors and nurses working in the private sector. So now I want to bring on Dr. Efa. He is one of the FIND team working with the Ministry of Health, and he will be just introducing about the chronic disease care process. In other words, what is common for all these diseases which are non-communicable diseases, any communicable disease, non-communicable disease which is a chronic disease.